done well, but somebody gets sort of hit by a bus or something silly happens. You can't protect against all eventualities in life. You have to lead a useful life for yourself, for your children, and for the community. And in that process, if you can, stay within the right side of things, that's the best you can do. No amount of medicines can keep you in the perfect effect. You have to take some ownership of yourself, and certain things you have to leave to nature.
First of all, I appreciate the Indian Embassy and the Doctor Association Forum for arranging this excellent program. So I have two questions. Whether I can invite a speaker to my company where we have around 150 Indian workers, whether it is possible or not, that I need an answer. Then second is regarding my personal ailment. See, recently, 6 months back, I developed a chest pain. It is not exactly a chest pain. I consulted with some doctors, and they said it is not a chest pain. I'm having a pain on my chest, and I recently found that I have a low vitamin D level. Is it due to that, or because of any coronary heart related problems?
Okay, we will have quick questions and quick answers, because otherwise it will keep on forever. Number one, the answer your question about arranging a talk, you please talk to one of the office bearers of Indian doctors, Warren, Dr. Grover or Dr. Wani, they will arrange it. Number two, see, low vitamin D level has been related to, or shown to be related. It doesn't directly cause it, it has been shown. There is a big difference between these two things. It has been shown to be related to so many things, including heart problems, hypertension, and all those, But then, is it the low vitamin D alone? Because if I check vitamin D in all these people who are sitting here, you all have low vitamin D levels. I've never seen a single person in Kuwait with normal vitamin D. See, vitamin D, why your vitamin D is low? Do you exercise? And before your low vitamin D levels, did you used to exercise? Where, when, what time of the day? You have to walk in the sun to get the vitamin D. So, if you walk, and most of that walking, if it is done in sun, then your vitamin D level will go up. And people have shown that can actually reduce the incidence of heart problems. The statins? See, individual questions difficult, because we don't know the whole issue here. We cannot generalize anything. I mean, you have to consult your doctor, but statin, I wanted to say that statin, there is no controversy about statin. The statins are very good for the heart, people who have heart problem, people who have LDL. Some very small number of people can get some side effects, and then we may have to change the statin to another statin, or maybe stop it and go for another medication. Okay?
I'll just elucidate a little bit further, rather than taking an individual example. Statins have been shown to have a little side effect, not muscle pain, etc. yet, but they reduce the inflammation around the new deposition of cholesterol. Why, since 1980s, the incidence of death from heart disease has reduced is all because of modern medicine and modern technology. But statin, if you take, is not only for your cholesterol. Aggressive lowering of, most recent studies after stenting have shown that you take 80 milligrams. The higher you take, the lower the LDL, the better it is. There is a cutoff limit of about 40 milligrams. For brain cells to function effectively, you need a little bit of cholesterol. So you don't have to bring your cholesterol down to that level. But generally, if you are taking statin, you should take it, you should consider it as a vitamin. If you have heart disease, you should not think of reducing it, because it has an anti-inflammatory effect as well.
Thank you.
One question is, what is the lifespan of a stent, and what is the probability of reoccurring a blockage at the same place, or this is?
See, there are various types of stents available in the market. The earlier ones, it's called bare metal stent. That means without any medication. But most of the stents we are using now and all over the world is medicated stents. The medicated stent, there are different varieties. I mean, nobody can say, how long a stent will last. It all depends on how nicely you're going to take care of it. For example, as he said, if you take a high dose of statin and keep your LDL level quite low, if you exercise regularly, if you eat good food, and if you take care of the stent that way, it will last for a long time. You cannot put any number of years on it. But there is a small number of people, around 6 to 8%, that is about 6 or 8 out of 100, who may develop some narrowing or restenosis of the stent after a year or two. But again, I stress that point. If you take care of your stent, it will last. You agree with that?
Yes, certainly. I think instead of asking individual questions, because this will become a consultation, ask a specific area. We will be very happy to, yes.
Doctor, I had a bypass surgery about 3 months back.
Right.
And after the surgery, I was getting cold, and it has been treated by doctors back in India. Now I am here. Whom should I contact? Whom should I visit?
You have one of our best trained doctors here.
If you want to go to a private hospital, we have a very good cardiologist here. And if you want a government hospital, I cannot see you because it depends on which area you're coming from. Which area?
Salmiya.
Okay, you go to the polyclinic.
Okay.
You say you had a bypass surgery. They will give you a reference to cardiology department in Mubarak Hospital.
Good.
And you will be seen definitely by one of the cardiologists. There's no problem. So the reference has to come from the polyclinic. Because these hospitals are all referral hospitals.
Okay.
Now, don't get me wrong, that doesn't apply in an emergency. Suppose tomorrow you develop sudden chest pain or some breathing difficulty, don't go to the polyclinic. You can emergency 24 hours available in all the government hospitals and some of the private hospitals. So I'm talking about regular references, routine references, you have to go to the polyclinic. But emergency, come straight to the casualty in Mubarak Hospital where the 24 hours it is covered by cardiologist.
Thank you all, doctor.
Okay.
I would like to ask you, doctor, a general question. What are the preventive measures one can take? Suppose my father had a cardiac problem, diabetic problem. I am fine so far. I have not been diagnosed for anything. What are the preventive measures one can take when the family history has got diabetes and heart disease?
If I can give you one message, one message for everybody to take home, please don't put on weight. Once you start putting on weight, the weight in Indians is put on, in Western society, it's an apple, a pear shape. In us, it's an apple shape. Means we put on weight around our tummy.
Right.
And this predisposes us to lot of metabolic problems. Predisposes us to diabetes, predisposes us to metabolic syndrome. And without going into the details of that, just try to reduce your waist-hip ratio. Don't put on weight around your waist. We are genetically programmed to put weight here. And once you start putting weight here, your blood pressure will go up, your incidence of diabetes will go up, and it will be very difficult for you to control. So prevention, just one message, that is keep your weight under control. And as our colleague was saying, that the BMI range has been reduced for Asians. Our obesity starts a little earlier. So the best way to help you is you can't help being born an Indian. You can't help being born with smaller arteries. You can't help having a slightly higher triglyceride, a slightly lower HDL. But what you can do is you can eat less and you can exercise more.
See, if you have a family history of heart problem, one of the things you have to find out is from your father, what was his risk factor?
Okay.
And and also, normally we advise people to check their cholesterol when they're in the 40s and all. But somebody whose father had a heart attack, especially if he was at a younger age, younger in the medical definition is below 55, then you should be checking your cholesterol, blood pressure, blood sugar, everything in your 20s. You cannot wait till 40s. Because you have a gene which is not good. And that gene starts working in your 20s. So I would say you go and check your cholesterol, blood pressure, blood sugar, and all those risk factors at an earlier age, number one. Number two, as doctor was trying to say, try not get into the habit of smoking, try to get into an exercise program. But prevention of risk factors at an early age is very important in somebody who has a genetic predisposition.
Thank you very much.
Okay.
Thank you.
Good evening. Two quick questions. The first one, if a CHD is suspected, don't I pop an aspirin in the mouth on the way to the hospital? Doesn't that improve survival? And the second question, if the surface area has an effect on CHD, do taller people have less risk of CHDs?
Simple law of physics. Taller people have a larger artery. If you have a larger artery, for example, in our legs we have arteries which are 5-6 millimeters. Okay, so they also get atherosclerosis, but it takes them longer. There's a theorem in physics called Bernoulli's theorem. Now, any artery which is reduced, or any tube which is reduced in size by 70% by stenosis within, the pressure drops from one side to another. So clinically it becomes relevant. Any stenosis becomes relevant if it crosses 50 to 70%. So the time taken for a 2 millimeter artery to reach 50 to 70% is earlier. So in the Western society, it takes a little longer. Second thing, treatment of smaller arteries is more fiddly. The stents for 2.25 millimeter have only recently come, only in the last 5 years. Initially, the stent size was 3 millimeter, and then it started at 2.5 millimeters. So to treat, and then if you bypass them, smaller arteries get clotted or clogged earlier because they are small. So it's to do with the speed of things. Second thing, your first question was aspirin. Now let's see what aspirin does. Aspirin reduces, thromboxane inhibitor. The platelets they stick together by an enzyme called thromboxane. So what's the complete name, I don't know, but it reduces the thromboxane. Okay, so you give 300 milligram first at the site of entry into a hospital if you're suspected to have an MI. If you want to take an aspirin, you can take an aspirin, but just bear in mind, you may not also be having an heart attack. So, carrying an aspirin in your pocket, more than that, if I can give you a general take-home message, rather than taking one specific this thing, his general take-home message is, in angina is a word started from a Latin name called anginus. Even Romans used to know that when you have something in the chest, the soldiers or patients used to die. So anginus is discomfort, if you literally translate that. It is never pain, as my colleague was saying, that is quite correct. The pain starts when the muscle starts dying. Before that, it is discomfort. And as a race, I know that because having worked in UK, where National Health Service is free for everybody. You don't need a referral, or you dial 999, you will come. Very few Asians would dial 999. They would always bury their head in the sand and say, "Ye gastritis hai, ye kuch aur hai." We never own up to the symptom. So don't disregard discomfort in your chest. Maybe 9 times out of 10 it may turn out to be nothing, and you will have an ECG and you will have a blood test and you will come home. But particularly our women actually are notorious for ignoring their symptoms, going to the hospital late, and then finding they have triple vessel disease. Is that correct?
I think to answer to your question, popping an aspirin in your mouth with chest pain, I will not advocate that. Because how do you know you have a heart attack? On the other hand, if you have a heartburn from severe acidity, it will make it very worse. So I don't think it's an advisable thing to do. Thank you.
Blood pressure of more than 130 is supposed to be abnormal. Is it true for all ages, or the blood pressure has any relation with the age factor?
Yes, absolutely. The blood pressure has a relation with age, and as you go old, your blood pressure will go up. That's why there's a criteria they use. In younger, for example, somebody who's 20, blood pressure of 140 by 90, I don't like it. It's not normal. But if somebody is 60, 65, 140 by 90 is okay. So that definitely depends on the age. And there's a WHO criteria we always use. Okay, next one, please.
Thank you very much, our Indian ambassador and IDF, for arranging such an informative session. So my question is, you said we have very good hospitals in Kuwait. I also know that we are very good. Whether these facilities like bypass surgery All these things, our friends are going to, Indian friends are going to India rather than going to Kuwait hospital. Before they used to go, before the war, they used to go Kuwait hospital only. Nowadays, they prefer to go to India rather than here. So could you enlighten some of the facilities available for, especially for expatriates here in for major, major risk factor like heart disease, diabetics, and other things. Thank you, sir.
See, there are certain things. I have to be very diplomatic, like the Indian ambassador. There are certain things I cannot discuss in public. Now, as I said, if you get a heart attack, if you get chest pain, and if you are having a heart attack, all the hospitals are well equipped with the treatment, and we do that. But when it comes to certain sophisticated things like a bypass operation, when you discuss with the family, we also advise them to go to India for two reasons. Number one, their family members may be in India. Number two, there's no comparison between the experience of an Indian doctor who is working in India versus any doctor working here. Because he will be doing 4 or 5 bypass operations every day, whereas here the surgeon may be doing once a week or twice a week. So the experience of the surgeon is very good. And third thing is post-operative care. Many of the hospitals, again I cannot discuss the reasons, post-operative care is not that good. So whereas if you go to good hospitals like Apollo or Escort, the post-operative care and the surgeon is good. That is why people who can afford, definitely bypass surgery is better in India. Okay.
If you want to do it, we can do it, sir.
Yes, if you want to do it, it is doable here, and also it is completely free of cost in the government hospital. In chest disease hospital, there are 4 or 5 surgeons, and they'll do it for you. But then there is a waiting list. There is a waiting list. Waiting list depends on who you are. For an average normal man, it may take up to 4 or 5 months waiting list. So people may not be willing to wait that much. And you cannot choose the surgeon. You cannot say, I want an Indian doctor. It's not always possible. Actually, there are no Indian doctors who are doing bypass surgery. And that's another reason why people want to go back to India.
Go with little Basta, you'll get the best.
But if you have any general surgery, then go to Dr. Grover. Okay? Unfortunately, he's not doing cardiac surgery.
Yes, we don't prefer to go to private clinic. It is costlier than Apollo here. So
The private clinics are coming up, and it is expensive, but it's like my friend who has joined. There are good doctors coming into the private sector now. So
to my knowledge, there is no private hospital here who does
No.
bypass.
bypass surgery is not in the program, I'm in private in Kuwait. Okay, I hope that answers the question. Okay.
Thank you, doctor, and everybody. I would just like to ask one question. Sorry, I'm here. In your presentation, you suggested that cooking of oil or overheating of oil is not good. So what you suggest here, when those people who are cooking, they
As
should...
we were all trying to say, in life, moderation. As I said, as he was also saying, Dr. Vinod was saying, we are not here to suffer. Okay, we have to enjoy life. We have to be happy people. So what we are trying to say is, if you are using oil, it for a long time. Number 3, most important, after Dr. Vinod said, if you have used an oil for frying your chips or something, throw it away. Don't use it again. If you use the boiled oil again and again, then the peroxidase come, then the oxidization happens. So, message is moderation, minimal amount of oil, try not to fry it for too long, and don't reuse it. Okay?
Thank you very much. That's clear.
Any other question?
Can I reassure you, all of you must have, or the questions, by the questions I can understand, you have some individual scenarios of yourself. Once you have developed heart disease, your chance of reaching 80, 85 are very high, provided you do 3 things in life. One is take your medication regularly. Number 2, don't put on weight. Number 3 is keep visiting your cardiologist or your hospital. That, once you have developed a block, it is likely that you might develop another, in 5 years, 10 years time, another block. So keep a follow-up, a good follow-up, don't put on weight, and keep taking your medication. Your chance of reaching your predetermined life expectancy is very, very high. You know, you're all survivors. If you have heart disease now, you're all survivors if you're sitting here. The problem with heart disease is only when they don't reach the hospital. That is the problem. That is the reason why I was just trying to say that don't ignore your symptoms, particularly the women in our society. Don't ignore your symptoms. Go to a hospital early. Once you're diagnosed, your chance of actually carrying through the journey in life is very high. How many people do you see that, they don't reach the hospital, that's fine. But once they reach the hospital, you have treatment and you're taking their treatment. Very few of you actually die untimely deaths. Is that a fair question?
Yeah, we have a step-by-step approach to chest pain. The first one to do is an ECG. Then we do an exercise ECG. If we get the diagnosis, we stop there. And if we don't, then we have to go for what is called a nuclear test. If we don't get it there, we may go for a CT coronary angio, which is an angio from outside. If we are not happy with that, then we will go for a coronary angio. So that's a textbook description of approach to problems.
Yes, sir. One important thing is that a lot of young people start developing diabetes as well as hypertension or even suffer from angina, following which they are evaluated and they are given certain medications. But suppose at the age of 42 you develop it. After 5 years, you will be perfect, like running, having the normal life, taking the normal diet, enjoying the life as it is. Then people tend to be complacent. They tend to feel that why I should take, let me stop all these medicines. Then somebody will induce something from the internet, no, don't take these medicines and a lot of side effects. And the people tend to fall for it. And such people are at a higher risk of developing complications, that to the florid complications, than the other people. So please be compliant to medications. And if you have any disbelief or any controversies regarding any molecule, please do consult your doctor before stopping it. Because I'm sure Dr. Suresh, as well as Dr. Dhawan, might be seeing a lot of people who are coming with complications as a matter of just because of stopping these medicines.
Yeah, I endorse that view because I have seen people, this is a daily common practice in India and world also. After taking this medicine for some time, somebody will say Ayurveda is good. They will stop all this medicine and they will take Ayurveda. I have nothing against Ayurveda, but Ayurveda is not a scientifically studied system of medicine. And only, if you want to do some massage and some oil and all is good. But taking medicines for a serious heart problem, you will end up in very serious problems. I've seen everything.
Yeah. I just have a couple of questions. Regarding the statistics, do you have any numbers, incidence rate of heart attacks in India among people 45 years and under, and the death rate among them? So that we can have a comparison, because in the initial, in the beginning, we were told that there were over 400 deaths, Indian deaths, in Kuwait.
This is all based on very good statistics and very good studies which have come out.
Yeah, let me complete my question. More than 400 deaths in Kuwait. I'm here.
Okay.
400 deaths in Kuwait, among Indians, and there were 175 due to coronary heart diseases. So my question is there any research in India, coronary heart diseases, heart attacks among Indians who are less than 45 years and the death? And number two, among Indian population, immigrants in the United States, did they do any research as far as the age related, 45 years and less, And last question is, any message for Indian parents who are raising their children in this country?
Well, the first question is, there are hundreds and hundreds of scientific publications from all over the world, from US, from UK, where we were together, the University of Manchester, we have published papers together. And so it's well documented. There is no doubt about it. Number two question is that raising your children in this country?
Yeah, what message,
you want to give the
The
Indian
message
parents?
is, as Dr. Vinod was saying, these diseases start from an early age. So from an early age, you have to teach them good food habit. Don't you think that, McDonald's and Kentucky Fried Rice is okay until the age of 20 and then you can stop it. First of all, that habit will form, number one. Number two, if you give all this fried food to the children, their coronaries will get blocked at an early age. And then, so that's diet. Number two, exercise. From an earlier age, you need to tell them to do some cycling or walking. So all these good habits, you have to inculcate them from an early age. Now, when I talk about happy people and happy life, I don't think many of you are going to change your life. I know that. When I spend 2 hours here, I know that. I think our education should start in the schools. I think that the second and third year children, third standard children, we should not be teaching them mathematics and science. We should be teaching them life, how to cross the road, how to eat, how to exercise. Okay? Thank you.
From the question, it seems you are interested in knowing numbers. I'll give you 2 names. One is Srinath Reddy. He has done a lot of work in India from Holiday Institute. Second is Enos from US. He did a lot of work on Asian physicians in US and amount of heart attacks. If you Google these, you will get a lot of statistics about raising children. Good and bad always goes together. If you observe nature, good and bad always goes together. If we have bad coronary arteries, we have many things good as well. Look at the family structure. The children are the same set of parents throughout their life or most of their life. So you can't prevent